You know that feeling you get when you're just about to start a new journey, a new job, maybe a vacation or some kind of trip that is just right in front of you, and you have both of those feelings kind of mixed together. You know, the ones that excited about what's happening, but a few butterflies about some of the unknowns. What would happen if you could be more confident that whatever happened on that journey, whatever happened, you could manage it? That's what we're going to talk about today on viral healthcare. Hi, I'm Bruce Spurlock. I'm a physician and healthcare leader committed to helping decision makers and physicians, professionals of all kind, navigate change with clarity. On viral healthcare, we look at the trends and innovations and ideas that are spreading throughout healthcare and trying to understand what makes them work, what makes them sustainable, and what makes them effective. Today's session is a reflection of what we talked about on Tuesday. On Tuesday, we had this discussion on the live component of this podcast where we were looking at this liminal space. What's that mean? This liminal space between you've decided to move ahead, but you're not quite ready to start. It's kind of like in the sports analogy, you're in the locker room and the coach is about to send you out to start the game. And what do you say? What do you do to increase the chances that you're going to be successful with that next endeavor, that next journey? So we're going to talk about that things, preparing ways to make sure that you can have a lot more confidence or early warning signs that you need to stop. If it's not going your direction, if the thing is going to fail, it's better to have it fail early, reassess, and then move forward with either course correction or stopping it completely. We're going to talk about the sunk cost fallacy in the future. That's where people get fixated on the amount of time and energy they've already spent that they can't really see forward because of all of that, all those sunk costs, all of those investments that they've happened. So one thing it's really important to realize is that every good idea that we've ever seen in healthcare will fail sometime. Even good ideas fail. And so the question is, what can we do to anticipate some of those problems along the way? We're going to talk about three tools that we mentioned on Tuesday in more depth. The first one is something I've done many times and I really enjoy. It's called the pre-mortem. So, you know, in healthcare, we do the post-mortem. After somebody dies, we do whatever CT scans, pathology, the whole understanding to figure out what caused the death, what went wrong that led to that. This is that same idea, but we're going to do it before we actually even start the activity. So we imagine in our heads, it's a thought exercise. What would it look like in 2 years if we put all our time and effort into this project and it failed? Why would it fail? And as you start asking that question with your colleagues and with the people that you're working with, lots of ideas bubble up. And they're really instructive because you can actually start thinking about how you might anticipate, mitigate, or use that as signals that you need to stop if you can't overcome them. There are a lot of hidden things that you can do on the premortems. I did this once in a group with about 200 physicians. And we said, you know, imagine at the end of this project, 2 years from now, we're going to fail. Why is that happening? And it was really interesting. It was this big auditorium. People started coming up with that reason and this reason, all the good things that you use a pre-mortem for. And then it became this us versus them. Well, it's because the younger physicians are doing this. No, it's because the older physicians get stuck in their old ways. And that really was kind of just beneath the surface in this setting that really kind of bubbled up because of this pre-mortem exercise. Now we got to go back and say, okay, how are we going to manage this cultural, this relational issue in the organization? It's pretty fun to think about how we do that, in addition to many good ideas about things we need to anticipate, mitigate, address, deal with, figure out if they're right or if we can overcome some of the challenges that they came up with. So a pre-mortem is a great idea. The next one, we've talked about this before. It's this idea of phoning a friend. You know, when you really about to start, you should look for other organizations that look and act and have the same sort of context, the same characteristics as you, and then call them up. I mean, people responded that I saw that you guys took this challenge on. We're really interested to see what happened. And even better, if you're at a meeting or somewhere and you hear about somebody that struggled with it, like find out why did you struggle? Understand from them personally what happens. You know, it's not just for how to make a million or how to become a millionaire in that movie. It really is this notion that there are outside perspectives that you may not have considered that have a much more detailed understanding of what's happening, especially if the organization looks like yours. The third thing, and we're going to probably spend a whole session on this, a whole week on this idea of setting tripwires. What are tripwires? In my mind, it goes to the movies, the TV shows where people hit something and there's a big explosion. Well, they don't have to be that dramatic, but tripwires are sort of pre-planned events, timing, toll gates, milestones, something that you anticipate you should be hitting or else it's a danger sign. It's a signal that you might be having some challenges more than you anticipated. It's really less of a tool than a public commitment, a commitment that says, yeah, we're going to take the chance that we might have to stop this project if we really start having problems. In quality improvement, we call them balancing measures. It's the robbing Peter to pay Paul or the unintended consequences. And if you can think about them and make them really specific, precise, measurable, something that's objective that you can't not address. It gives you a chance to pause and course correct or give up. And it's really hard because what it means for organizations, this is why we don't see a lot of these. We see some, is that they're going to like publicly declare something that they may not be doing on the rest of their for the rest of their journey. And a good example is the Camden Coalition. You might have heard of them. They're based in Camden, New Jersey, and they did this incredible work in the late 2007, 2008, 9, 10. In 2011, they were highlighted in the New Yorker for their program on hot spotting. What they did is people that came out of the hospitals that often were frequent flyers and frequent readmissions, they tried to figure out what was going on, mostly clinical, but they also had social things. For example, patients with asthma were living in an area where the stimulants, the mold, and the other things that were in their home were causing recurrent trips to the emergency department. And so trying to isolate that with additional services, with additional care management, with nurses going to the home for that population seemed to do a good thing. There was this before and after data that seemed to be suggestive it was is going to be make a difference. They really did something unique. They committed to a randomized controlled trial. For those of you who don't know that, that means that on a random basis, a patient will get their services and the next one might not. And so you never know which patient's going to get it, which one's not. And then you can compare the ones that didn't get the service with the ones that did. And when they did that study very rigorously, they found there was no differences between the group. What's that mean? In that before after period, they were looking at this thing called regression to the mean. And during the randomized control trial, it showed that there was really no improvement based on that. And while it was a failure and obviously huge blow to the Camden Coalition, they were really incredible how they looked at it as a learning lesson. And they said, this care coordination and readmission is just so much more complex than thinking about we could accomplish that in such a short time. So a really good way to describe not really failure as much as how we learn about the complexities and ways to improve and drive the system. So that's a tripwire. There's a lot of them out there. You can set timelines, you can set quantitative goals. You can say we have to hit this amount of improvement by such and such a date. And if you don't get it, it doesn't necessarily mean you have to stop. You just need to reassess. So I'm going to go back for a second, just ask you this question. Are you in the process of thinking about making a major decision for your organization? Or have you made one and you're about to launch, you're about to announce the start of the program? Think about how you might use some of these tools, some of these ways to sort of anticipate so that when problems come your way, and some of them you may not be able to anticipate. I mean, nobody could have anticipated COVID back in 2019. But things that you couldn't, you might not be able to anticipate, you're more able to respond to them more rapidly because you're in that sort of mindset already. Then you should spend some time doing that. Now, if this was useful for you and you'd like to share with a friend, please do that. I'm really interested in learning your experiences. If you've got an example of this, if this happened in your organization, if you stop something, I'd love to highlight, I'd love to talk to you and interview you to understand what it was that helped you make that decision. It's hard for people to be vulnerable and say, we went down this pathway and it didn't work for us, and to talk about that. And it'd be great to share some of those ideas with other people. So that's my reflection for today on viral healthcare. Next time, we're going to actually talk about what you do after you launch. What are the components to implementation that are really valuable and critical for you to be successful with your new idea? So that I'm Bruce Spurlock, and this is Viral Healthcare. Can't wait to see you next time.